The Ministry of Tourism and Wildlife has issued a public advisory warning Kenyans against handling or consuming bushmeat, as Mpox is a zoonotic disease that spreads from wild animals to humans. And even as the Ministry of Health says there is no cause for alarm, stakeholders in the health sector have called for proper preparation to avoid a crisis in case of a serious outbreak such as that of the COVID-19 pandemic. And as Emily Chebet reports, Africa Center for Disease Control has called for accuracy in testing and proper handling of samples in order to avoid missing cases spreading in the community.
A day after the Ministry of Health announced the second case of Mpox in the country, the Ministry of Wildlife and Tourism has weighed in, warning Kenyans against consumption and handling of game meat in order to reduce the spread of zoonotic diseases like Mpox. According to a statement by Tourism Cabinet Secretary Rebecca Miano, as guided by medical and animal health experts, Mpox is a zoonotic viral disease which is communicable between wild animals and human beings. Aside from Mpox, other diseases portended by handling or consuming bushmeat include, among others, coronavirus, Ebola, salmonellosis, rabies, anthrax, brucellosis and Rift Valley fever, thus making the call to stay away from bushmeat urgently. Stakeholders in the health sector have said lessons that were learned from the COVID-19 should be implemented in order to avoid any crisis in case of an outbreak. Kenya Medical Practitioners, Pharmacists and Dentists Union wants the government to ensure healthcare workers are well prepared for any eventuality.
5 years down the line now that there's a bit of a scare of Mpox, we have not seen much of action or much of implementations of the things that were proposed well down during the COVID-19. We need to have employment of health workforce. We need to have drugs available in the hospitals. We need to have mechanisms of protection. And we need to have a motivated workforce.
PS at the Ministry of Health, Mary Muthoni, visited Malaba border where the latest case was reported and assured Kenyans that the ministry is on top of things.
We are enhancing our risk communication to ensure people can be able to identify or the suspected cases. If you suspect somebody has Mpox, then it is good to advise them to go to the nearest health facility.
Africa Center for Disease Control has on its part called on African countries to ensure accuracy in testing and collection of samples in order to reduce the spread of the virus. According to Africa CDC, if the sample is taken too early or too late in the course of the infection, the viral load might be too low to be detected. Africa CDC says the type of sample collected, for example, from a lesion, blood or other bodily fluids, can affect the test results. Lesion swabs are typically the most reliable, but if a different type of sample is used, it may not contain enough viral material for detection. In some cases, an individual's immune system might clear the virus or suppress its replication to levels of undetectable by laboratory tests, even though the disease was present. These stakeholders have called on the Ministry of Health to heighten surveillance and training of healthcare workers on how to detect and handle suspected cases. Emily